Most adults over 60 ignore this subtle warning sign until it is too late. You might mistake it for simple forgetfulness. But the truth buried in the biological landscape of the brain tells a very different story. We often hear the terms Alzheimer's and dementia used interchangeably, as if they describe the same destination. However, viewing them as synonyms is a critical error that keeps millions from seeking the right support at the right time. Today, we are stripping away the confusion. We are going to look inside the brain, observe how these conditions manifest in daily life, and identify exactly when you should move from concern to clinical action. Understanding this distinction is not just about medical vocabulary. It is about reclaiming control over your future health. Many people spend years worrying about the wrong things, while the actual triggers for cognitive decline go unnoticed. By the end of this journey, you will know exactly what to look for in yourself and your loved ones. Let us begin by clearing the fog surrounding the terminology. If dementia is the umbrella, Alzheimer's is the storm beneath it. When doctors use the word dementia, they are not naming a specific disease. They are describing a broad category of symptoms that affect cognitive functions, like memory, reasoning, and social skills, so severely that they interfere with daily life. Imagine an umbrella that covers many different causes of brain decline. Some of these causes are permanent and progressive, while others might be reversible if caught early. This is why the distinction matters so much. A diagnosis of dementia tells a clinician that something is wrong, but it does not tell them why. Finding the why is where the real work begins. And here is where the story gets more complex, because the most common cause of that umbrella of symptoms is Alzheimer's disease. But there are others, and confusing the two can lead to missed opportunities for treatment. Are you prepared to look at the differences that actually change how we approach aging? Let us move into how the brain physically changes when these symptoms take root. To truly grasp why we face these challenges, we must look at the architecture of the human brain. Think of your brain as a vast, highly efficient electrical grid. Information travels along pathways, jumping between cells to allow you to recall a memory, plan your day, or recognize a familiar face. When we talk about dementia, we are looking at a system where that grid is beginning to fail. In Alzheimer's disease, this failure happens in a very specific, predictable, and aggressive way. Researchers have identified two primary culprits: plaques and tangles. Imagine sticky protein fragments called beta amyloid building up between your nerve cells. These plaques act like grit in a delicate engine, preventing the cells from communicating properly. Simultaneously, tau proteins, which normally support the structural integrity of the cell, begin to twist into tangled threads. When these two processes occur, the cells essentially starve and stop functioning. Now, contrast this with other forms of dementia. Vascular dementia, for example, is not caused by these proteins. Instead, it is caused by restricted blood flow to the brain, often due to small strokes or damaged blood vessels. The result: memory loss and confusion. Looks similar from the outside, but if you treat a patient with vascular issues using an Alzheimer's drug, you are not hitting the root cause. This is the scientific reality that dictates effective care. Many people assume that cognitive decline is an inevitable part of the aging process. This is a dangerous myth. While our processing speed might naturally shift, the pathological decline we see in Alzheimer's is not a standard byproduct of getting older. It is a disease process. Understanding this allows us to stop blaming old age and start observing the specific patterns of change. Why does one person struggle to find the right word while another forgets where they parked their car for the third time in a week? Is it just stress? Or is the brain signaling a deeper issue? We are about to look at the day-to-day indicators that often get dismissed until they become unmanageable. Let us step away from the lab and into the kitchen and the living room. How do we distinguish between the normal, frustrating, senior moments, and the clinical markers of a progressive condition? Everyone, at any age, occasionally walks into a room and forgets why they went there. That is a distraction, not a disease. However, the pattern changes when the memory loss begins to dismantle your daily routine. Take, for instance, the concept of executive function. This is your brain's ability to plan, sequence, and execute complex tasks. If you have been cooking the same family recipe for 40 years and suddenly realize you have no idea how to follow the steps or which ingredient comes first, that is a significant red flag. It is not about forgetting an ingredient. It is about losing the logical sequence of a familiar process. Then there is the matter of disorientation. This goes beyond forgetting the name of a distant acquaintance. It involves losing the sense of time and place. Does the person recognize their own neighborhood? Can they navigate a route they have driven 1,000 times? These are signs that the internal mapping system of the brain is being compromised. Another subtle, yet powerful indicator is the change in emotional regulation and social behavior. Sometimes, early-stage Alzheimer's manifests not as memory loss, but as a personality shift. Perhaps someone who was always gentle becomes unusually irritable, suspicious, or socially withdrawn. Family members often chalk this up to crankiness or life stress. But when we look at the neurological scans, we often see that the areas of the brain responsible for impulse control are the first to experience the impact of plaques and tangles. We have to be careful here, as we must not become hyper-vigilant and diagnose every mistake as a tragedy. But we must be observant. When a behavior becomes a consistent pattern, it deserves a professional evaluation. What is the one thing most people get wrong when they start noticing these signs in their parents or themselves? They wait. They wait for it to get better. Or they wait for proof that things are really that bad. But by the time the symptoms are obvious to everyone, the disease has often been active for years. What happens in those quiet, intervening years? And why is early detection the most powerful tool you have? We need to discuss the timeline. The biological process of Alzheimer's often starts a decade or more before the first memory lapse is ever noticed. This is the silent phase. During this period, the brain is remarkably resilient. It uses compensatory mechanisms, essentially finding detours around the damaged cells to keep your thinking sharp. This is why you might feel perfectly fine while the pathology is already present. This resilience is a double-edged sword. It protects us in the short term, but it hides the disease in the long term. Many people ask, if there is no cure, why bother with an early diagnosis? This is a critical misconception. Early diagnosis is not just about receiving a label. It is about access to management strategies that can preserve quality of life, allow for long-term planning, and provide a chance to participate in clinical trials that are reshaping how we treat the disease. Furthermore, not all dementia-like symptoms are caused by incurable brain diseases. This is the most hopeful part of our discussion. Certain conditions can mimic dementia symptoms perfectly but are entirely reversible. For instance, a severe vitamin B12 deficiency can cause memory loss and confusion. Thyroid imbalances, chronic dehydration, or even medication side effects can create a state of cognitive dysfunction that looks like dementia. If you assume it is Alzheimer's and do nothing, you are missing the chance to resolve the issue. If you seek a medical evaluation, you might find that you don't have a progressive brain disease at all, but rather a treatable health imbalance. This is why I stress that you should never assume the worst without a full clinical workup. The doctors will perform cognitive tests, blood panels, and brain imaging to distinguish between these factors. It is a systematic process of elimination. But once you have that clarity, you can begin the real work of brain health preservation. And believe it or not, the things you do to protect your brain today are far more effective than any miracle pill currently on the market. Let us look at what the science says about the habits that actually move the needle. When we talk about preventing or slowing the progression of cognitive decline, the focus often shifts to supplements and brain games. While puzzles and crosswords are great for keeping the mind active, they are not the primary defense. The real, evidence-based interventions are surprisingly grounded in cardiovascular health. Think of it this way. Your brain is the most energy-hungry organ in your body. It relies on a constant, steady flow of blood to deliver oxygen and nutrients. Anything that negatively impacts your heart and blood vessels will inevitably impact your brain. This is why the heart-healthy lifestyle is also the brain-healthy lifestyle. Let us start with physical exercise. Research consistently shows that aerobic activity, things that get your heart rate up, promotes the release of neurotrophic factors. These are essentially growth hormones for your brain. They support the health of existing neurons and, in some cases, encourage the creation of new synaptic connections. It does not require training for a marathon. A consistent, brisk walk for 30 minutes a day can have a measurable impact on brain volume and cognitive performance over time. Then there is the nutritional component. You have likely heard of the Mediterranean diet. It is not a trendy fad. It is a long-studied, nutrient-dense way of eating that focuses on healthy fats, lean proteins, and a massive variety of plant-based foods. Omega-3 fatty acids, found in fatty fish like salmon, and antioxidants from berries and leafy greens are the building blocks of a resilient brain. They help reduce the systemic inflammation that contributes to plaque buildup. But there is a hidden villain in our diet that most people underestimate. Sugar. Chronic high blood sugar, or insulin resistance, is increasingly being linked to cognitive decline. In fact, Some researchers have begun to refer to Alzheimer's as type 3 diabetes of the brain. When the brain cannot efficiently use glucose for energy, it begins to suffer. This is a game changer because it means that controlling your blood sugar is one of the most effective ways to protect your cognitive future. What about social connection? We often overlook it, yet it is arguably as important as diet and exercise. Social isolation is a quiet, dangerous epidemic among the elderly. Humans are fundamentally social beings. When we engage in conversation, debate, and social interaction, we are forcing our brains to work on multiple levels simultaneously. We are processing auditory information, reading facial expressions, and formulating complex responses. This is a massive workout for the neural networks. Studies have shown that seniors who remain socially active and involved in their communities have a significantly lower risk of developing cognitive impairment. This doesn't mean you have to be the life of every party. It means avoiding the trap of staying at home in silence. It means joining a book club, volunteering, or simply keeping a regular schedule of coffee with a friend. These interactions are not just for our emotional well-being. They are essential for keeping the brain online. Now, let us address one of the most common mistakes people make when they start feeling off. They stop doing the things they find challenging. If you find it hard to balance your checkbook, you might ask a family member to take over. If you find it hard to learn a new piece of technology, you might give up on it. This is a natural reaction, but it is a trap. The brain functions on a use it or lose it principle. When we offload all our cognitively demanding tasks to others, we are effectively telling our brain that it no longer needs to perform those functions. This leads to faster degradation. Instead, we should focus on cognitive stretching. If a task is hard, do it slowly. Ask for help, but keep participating. Keep your brain in the driver's seat for as long as possible. Many people also make the mistake of hiding their symptoms out of fear or shame. They worry that admitting they are having trouble will make them lose their independence. But the irony is that hiding these problems only ensures that they will become worse, eventually leading to a loss of independence that could have been managed or delayed. Let us talk about when it is time to have that difficult conversation with your doctor. Deciding when to go to the doctor is often the most anxiety-inducing part of this journey. The fear of a label often stops people from seeking the diagnostic clarity they need. So, let's define the threshold clearly. You should schedule a comprehensive checkup if you notice persistent, recurring changes in your cognitive state that are not related to a recent illness or medication change. Specifically, look for a decline from your previous baseline. We are not comparing you to a 20-year-old. We are comparing you to who you were a few years ago. If you notice that you are repeating the same stories multiple times in a short conversation, that is a sign of short-term memory failure. If you are struggling with complex financial decisions that were once routine, that is a sign of executive function decline. If you find yourself frequently lost in familiar surroundings, that is a red flag for spatial temporal awareness. When you walk into that doctor's office, do not just mention the memory loss. Bring a list. Write down specific examples of where and when the confusion occurs. This helps the physician filter through the noise. Ask them to check the basics: blood pressure, vitamin levels, thyroid function, and hearing. Yes, hearing loss is a major, yet often ignored, contributor to cognitive decline. When the brain has to work incredibly hard just to process sound, it has less processing power left for memory and higher-level thinking. Treating hearing loss is one of the most underrated ways to protect the brain. When you speak to the doctor, do not hesitate to ask for a referral to a neurologist or a geriatrician. These specialists are trained to see the nuances that a general practitioner might miss. They will likely use tools like the Mini Mental State Examination or the Montreal Cognitive Assessment. These are not tests to pass or fail. They are snapshots of how your brain is performing right now. They provide the starting point for a treatment plan, which might involve lifestyle modifications, medication to manage symptoms, or in some cases, clinical trials. Why does the timing of this appointment matter so much? Because the health of your brain is not static. It changes based on the inputs you give it every day. As we move further into this, I want to clarify something about the progression of Alzheimer's. It is rarely a sudden collapse. It is a slow, gradual shift. Because it is so slow, it is easy to normalize. One day, you forget a name. A month later, you misplace your keys. A year later, you have trouble following the plot of a movie. Each step feels small, so we explain it away. But when you look at the trajectory over 5 years, the cumulative effect is significant. This is why keeping a health journal is so vital. By recording your observations, you can see the patterns that a doctor can then interpret. Now, Let's consider the environment. There is a concept called environmental scaffolding. This involves setting up your living space in a way that minimizes the cognitive load on your brain. If you find yourself struggling with daily tasks, don't view it as a personal failure. View it as a need to adapt your environment. Use calendars, whiteboards, and medication organizers. Set up routines for everything. Your keys always go in the same bowl. Your medication is always next to your water glass. These tools don't make you demented, they make you efficient. They free up your brain's limited resources to focus on more important things, like enjoying your hobbies or spending time with family. It's about being strategic. Many people resist using these tools because they feel like they are giving in to the disease. But in reality, using tools to support your cognition is an act of empowerment. It is taking control. We should also touch upon the emotional aspect. The anxiety surrounding memory loss can actually create a vicious cycle. Stress releases cortisol, and chronic high levels of cortisol are toxic to the hippocampus, the very area of the brain responsible for forming new memories. So, the more you worry about your memory, the worse your memory might actually perform due to the stress. This is why mindfulness, meditation, and stress reduction techniques are not just wellness buzzwords. They are biological interventions. Lowering your stress levels can genuinely improve your cognitive clarity. We have explored the biology, the warning signs, and the lifestyle habits. But there is one more piece of the puzzle that often goes unaddressed in these conversations: the impact of sleep. Sleep is the brain's nightly cleaning cycle. During deep sleep, the brain's glymphatic system, a waste-clearing mechanism, kicks into high gear. It literally flushes out the protein waste, including the beta amyloid we talked about earlier, that has built up during the day. If you are consistently getting poor sleep, you are essentially skipping the cleaning process. Over months and years, this allows for the accumulation of toxins that damage your neural connections. Chronic sleep deprivation, or conditions like sleep apnea, are significant risk factors for cognitive decline. If you snore, wake up feeling unrefreshed, or have trouble staying awake during the day, do not ignore it. Getting a sleep study might be one of the most important things you ever do for your long-term brain health. Addressing sleep apnea, for instance, can drastically improve your mental alertness and memory capacity almost immediately. It is another example of a treatable factor that can be mistaken for an untreatable disease. We are covering a lot of ground, but the core message remains consistent. Knowledge is the antidote to fear. When you understand how the brain works, you stop being a victim of what-ifs and start becoming an active participant in your health. The journey of aging is a natural progression, but the journey of brain health is one that we can influence. Think about the legacy you are building. It isn't just about how long you live. It's about the quality of that time. It's about being present, being able to engage with your family, and maintaining your sense of self. That is the goal of everything we have discussed today. We must talk about the importance of professional support systems. Whether it is your family, your doctor, or support groups, you should never try to navigate this landscape alone. There is a profound strength in transparency. Sharing your concerns with your spouse or children is not a burden. It is a way of inviting them to partner with you in your health journey. They can help notice things you might miss, and they can support you in the changes you decide to make. It changes the dynamic from a secret struggle to a collaborative effort. Let's address the elephant in the room. What if the diagnosis is Alzheimer's? A diagnosis of Alzheimer's is life-changing, but it is not the end of the story. Modern medicine is making significant strides in symptomatic management. While we are still working toward a cure, we have tools today that can help manage symptoms, stabilize mood, and improve functional independence for longer than we ever thought possible. Furthermore, the focus of Alzheimer's care has shifted dramatically toward person-centered care. This means we look at the individual behind the diagnosis. We focus on what they can still do, what they enjoy, and how we can adapt their life to maximize joy and meaning. It is not just about the loss of memory. It is about the preservation of dignity. If you are watching this because you are worried about a loved one, remember that your patience and your understanding are the most powerful interventions you can offer. The disease can make someone confused, irritable, or repetitive. It is not them. It is the disease. Keeping this perspective in mind helps maintain the bond between you and that person, which is fundamentally important for both of you. Stay informed. New research is published every week regarding diet, lifestyle, and pharmacological interventions. There are organizations dedicated to providing resources for families, such as the Alzheimer's Association, which offer incredible tools for navigating every stage of the condition. You are not alone in this. There is a global community working on this challenge. And remember, the brain-healthy habits we discussed, exercise, diet, social engagement, and sleep, are still incredibly valuable even after a diagnosis. They can slow the progression and help you remain as functional as possible for as long as possible. We have navigated through a lot of complex terrain, from the sticky plaques of Alzheimer's to the daily habits that protect your neurons. Let's bring it all together as we look toward the future. What have we learned? We've learned that dementia is not a singular disease but an umbrella of symptoms. We have seen that while Alzheimer's is the most common form, it is distinct from other types of decline, and understanding that difference is key to proper care. We have identified that the early signs are often subtle changes in routine and executive function, not just forgetting a name. We have debunked the myth that decline is inevitable, and we have established that lifestyle, cardiovascular health, and sleep are your strongest defenses. Most importantly, we have established that waiting is the biggest mistake. Whether you are 60, 70, or 80, it is never too late to start a brain-healthy routine. Your brain has a capacity for neuroplasticity, the ability to change and adapt, well into your later years. Every time you challenge your brain, move your body, or eat a nutritious meal, you are investing in your future. You're building a stronger, more resilient foundation for your cognitive life. Take the information from this video and turn it into action. Schedule the checkup if you have been putting it off. Look at your daily habits and see where you can make small, sustainable changes. Most of all, keep your mind engaged. Life is a continuous learning process, and your brain thrives on that curiosity. The fear of cognitive decline is heavy, but it is a weight that we can lift together through understanding, vigilance, and proactive care. Thank you for walking through this journey with me. This is not the end of the conversation. It is the beginning of a more proactive, informed approach to your health. Your future self will thank you for the steps you take today. The path forward is clear. Be observant, be proactive, and above all, stay connected to the life you are living. Before we close, I want to leave you with a final thought on the power of perspective. We tend to fear the brain's decline because we associate it with the loss of who we are. But the essence of a person, their values, their spirit, their impact on the world, is far deeper than the momentary functioning of memory. By focusing on your health, you're protecting the vessel of that spirit. You're ensuring that you have the clarity to enjoy your golden years, to share your wisdom with your family, and to stay present in the moments that matter most. If you found this information valuable, consider how you can share it with others. There is so much misinformation out there, and your ability to distinguish between myths and facts can help someone else in your community. Pass this knowledge on. If you have specific questions about these topics, stay curious and keep seeking answers from credible, science-backed sources. We will continue to explore these health pillars in our future content, delving deeper into specific nutritional protocols, the latest in neurological research, and the practical aspects of caregiving. Stay mindful, stay active, and stay committed to your well-being. It has been a pleasure to guide you through this complex, vital subject. Your health is the most important project you will ever undertake, and you have all the tools you need to do it well. Until we meet again, focus on those small, consistent actions that keep your mind sharp and your life vibrant. Take good care of yourself, and I will see you in our next deep dive into the science of health.